All right, Nori, thanks so much for joining me. So we're going to talk a little bit about schools and ABA and autism and IEPs and all of that fun stuff. But before we get started, I'd really just love to hear about you, about your experience, what you're doing right now, and just kind of give us a little snippet.
Absolutely. Yeah. Thanks, Maggie. Thanks for having me. Yes, I am a former special education teacher and director, primarily in Louisiana. I was in New Orleans for a number of years, kind of working in Title I schools. Um, Went away to University of Georgia and got my master's, and then went back to New Orleans. So I worked in school, and then decided I wanted to become a school psychologist. So pursued that in Texas. So I've kind of gotten to see different locations. And then in addition to getting my doctorate in school psychology, was very interested based on learners and families I had worked with supporting those with behavioral delays and lagging skills. So focused on that and incorporated ABA coursework and pursued and became a BCBA. And then my internship last year was at the Marcus Autism Center outside of Atlanta. So got to do a little bit of in clinic in my minor, and then was in schools like 4.5 days a week, really consulting. So we'll talk a little bit about ABA can look very different in schools, and there's a continuum of support. This year I'm at Children's Hospital. I'm a psychology postdoctoral fellow here. And am delighted to be working with Dr. Patrick Romani and Dr. Matt Loring. A majority of my time is spent on the neuropsychiatric special care unit, the NSC, and then also get to support neurodiverse patients and their families in outpatient, and working with Dr. Romani on some research projects. So I've loved transition to Colorado, and luckily there are lots of transferable skills. So it's been great.
I mean, it sounds like you've gotten to be kind of like all over the U.S. a little bit with your like not only licenses and whatnot, but your experience. My cousin works for the CDC, so I'm familiar with that area and the Marcus Autism Center. And I'm from Texas, and so I'm licensed there as well still. And now I'm here also. It's beautiful Colorado, right?
Yes. I must admit, well, it's technically the second snow out, but the 1.5 foot of snow, kind of first one out, was a little overwhelming, but it was beautiful for sure.
Well, it is a little overwhelming at times. It's okay. You weren't the only one who felt that way.
Yeah.
Well, thank you. Thank you for sharing that.
Of course.
It sounds like you have some really cool things to share with us. So tell me a little bit about what should parents be aware of when it comes to IEP development or starting that evaluation process? From your perspective, feel free to expound upon any of that, but just in general, what should they be asking for? How can we make them feel more confident?
Absolutely. So I think one of the first things that schools are required to give, but make sure that encourage families to ask for if they haven't received yet, are a copy of their parental rights. So making sure that they understand, and it can be very jargony. So in a lot of places that I've worked, there's kind of been 1 or 2 pages that kind of you get the full kind of booklet, and then the shortened version. So I always like to encourage families to navigate that and ask for support if needed, from school staff or other members of your community kind of support. I think that's really important, just to know kind of what are some of my roles and understanding. I think too, I always, especially towards the beginning of an initial evaluation or a transfer to a new kind of district or potentially even a new school, I always name for families as I used to facilitate those meetings. Like, there's a lot of jargon here, and we will try to name all of it for you, but please stop us and ask. I think in written form and vocalizations that are made in the meeting, I think it's really important that everybody understand what that jargon is. And it's tricky because some jargon, LRE, least restrictive environments, pretty universal, but there's some nuances, especially when it gets into content and potential academic supports, or people call behavioral things, different school districts. So just ask. And oftentimes I've found like SPED teachers are a really good co-advocate in those meetings to help facilitate that too. And then I think another thing that I always encourage schools to do and encourage families to ask for is copies of evaluations and draft IEPs before they get to the meeting. I always feel pretty rushed if I'm walking in and, the first time I'm getting a look at something, including potential data, is there in the moment. And, there's a big table of people, hopefully. And so I think asking for those copies beforehand is a really good recommendation, or something when possible. And I think too will help. Like, hey, with my prior written notice, can I get a copy of, even if it's a draft of what you're thinking about goals? I think will be really beneficial for families to ask for. And then I think the other couple of things that I think about are like, a question that comes up, especially in initial evals, is how is this going to change my child's day? Like, what is that going to look like? So the logistics of that's a great. So like, great, I understand this list of accommodations. Can you walk me through what this actually looks like in class? What is it going to feel like? How will we ensure dignity and not, pursue independence, but also support? I think those are great questions. And then I think thinking through, especially if initial and placement decisions are being made, or if there's a potential of change of placement. So is a student going from a fully inclusive classroom to maybe getting some resource, or even a 5th grade to 6th grade change like that? Mm-hmm. Even if it's inclusion, that's a very different, very different experience. So asking about what are the implications of this? And yes, we're going to be meeting every year, and hopefully maybe more frequently if goals are being met, et cetera, or if we need to adapt things. But I think kind of asking, hey, what are graduation implications? What are those kinds of things? I always really tried to name that, even for families with learners in elementary school, of like, this type of placement could allow this track to a diploma and or a transition program past 18. So I think there are, not that you are locked into a placement by any means, like it is supposed to be reassessed, but having those criteria and understanding potential implications, I think, are great questions to ask. And then I just tend to ask teachers for both academic, social, and behavioral, like, what are our goals? How are we monitoring progress, especially on the behavior side of things? Like, what are specific behaviors? What are specific criteria for different consequences? What will there be adaptations to a consequence ladder that's individualized? Like, are there different criteria for suspension if an autistic learner has made threats about bringing a gun to school, but is based on like a script from a movie that they've seen? Like, how can we adjust? So I think those are things to be asking too.
I think you bring up like excellent points. Absolutely. Yeah. Fantastic points. And I would think it's funny because in ABA, we always think about like the ABCs and how many little acronyms that we have for everything. And I think special education has its own massive amount. I'm also a licensed SPED teacher, so like I hear that. And I think you're right. I think it's so important for families to really understand what those terms mean and how it impacts their child. Because I think it is very easy to go into an IEP meeting and really not, just kind of sit there and like be like, yes, okay, yeah, we're working on these things, but not asking those questions like, okay, well, how are we measuring that? What criteria will, my child finally be sent home? Because if it's not documented and not everybody agrees to that, then it's not going to happen. And even there are, challenges with that implementation. in practice, right? And always kind of being that squeaky wheel and saying, okay, what about this? Did my child get this week? What does that look like? Or when is this going to start? Or how long will that FBA take? Or anything else like that? Those are phenomenal points to bring up. And I think part of what we can do is that after our call, we're kind of putting together resources. We can probably find those and attach those links. And so parents can click on them and get a quick reference.
Perfect. Yeah.
Yeah. All right. Well, you talked a whole lot about all of these great questions, right? So how would you recommend parents go in and collaborate with the school? What are your tips and tricks for that?
Yeah, I think one, you mentioned it, but I think ensuring things that are agreed upon are captured in writing. And if they're not officially in the IEP, that they're in the notes, or that you're taking really good notes during that meeting. And I think too, being open and honest about struggles at home or strengths at home, strategies that are working at home. Of like, hey, we found that if we do an extra 5-minute wait as kind of a reset, that's been really successful. So that's a great thing to know and can be built into a learner's day. I think too, as much as we want to document everything, I tend to advise don't respond in email or text emotionally. So I know, not towards family, but just as an adult in interactions, hey, let me take a breath. Let me use some of my coping skills, some of my relaxation strategies, and then really make sure that I'm able to problem solve and appropriately communicate this so that it can be received in the means that it's sent, to really support that learner.
It's an interesting place to be in, right? Because you want what's best for your child. Yes. And anytime, you have to read something, that email from the teacher, or that maybe they got sent home or whatever it was, that first instinct is to be emotional, right? That's who we are as human beings. I love that. But at the same time, you have to balance that and still work with your child's teachers and administration and the school district to make sure that at the end of the day, your child's getting what they need and they're getting those accommodations that they need to be successful.
Absolutely. Yes. And I think on the flip side of that, definitely document everything for yourself too. Because sometimes just to make sure everybody is doing what they need to do to support.
Do you have ideas, practical ideas as far as what parents could do to document? So for example, I keep, document a running record. I also keep a spreadsheet and things like that for my own personal needs and whatnot. But what do you suggest, if anything?
Yeah, so I think, yes, that kind of running document of the kind of official meetings for sure. I have found it successful to have in my for my personal stuff, for my Google Calendar, to capture in the comment section specific kind of or I chatted with this teacher, let me just capture it here. So some folks might do that in their phone notes or other ways, but I think kind of those one-off conversations can accumulate over time. So having a record of those, I think, can be helpful too.
Yeah, parenting is hard enough, especially when you're juggling all different things, but your brain space, right? Your active brain space is just not gonna remember things that happened 2 weeks ago, 2 days ago, you name it.
Absolutely. Yes. So yeah, I tend to capture it in a calendar because then I can remember. To your point, I'll have a vague recollection that it was Tuesday in the afternoon, but then I can go back and follow it exactly.
I love that. So we talk a little bit about that data piece on the parent side. I know we talked kind of before our meeting, a little bit about fidelity checks on implementation of intervention plans in particular. And I think, you have a unique perspective on that, just given the work that you're doing and then your experience, as a SPED teacher too. So let me hear what you got for that.
Yeah, so I kind of how we would train teams up on behavior plans and the implementation side of things is, I think that's two components. I think there's the training piece. So like, do you have these skills and the competencies to be able to actually execute a given strategy that's in a plan? Do you know what planned ignoring looks like? Are you able to competently, as a teacher, implement that in a classroom? So I like to use a task analysis or a fidelity checklist, like basically the different components that are written into a BIP or a BSP. So for both behavioral intervention strategies, but then also if they're preventative and reactive. So I'm thinking through each of those. So there's the training component, but then there's also kind of usually schools tend to be pretty good in my experience of like a couple of days later checking in and seeing how things are going. But then again, 2 weeks or a month later. So I think even if staff are self-monitoring and then getting some reliability with an external provider or external staff member, that could be really helpful. Of basically, did we do this today? Yes, no. And then as well, if the learner or child is able to, they could help or begin developing or concretize those self-monitoring skills themselves. So then the learner is self-monitoring. Did this happen in this class? Did it happen at lunch? And I think that's the other piece for implementation, is making sure that every adult that is interacting with that learner or child is getting that same training or a version that is appropriate for their environment. So I always think about electives or specialist teachers, bus drivers, if there's strategies that we know are successful in supporting this learner, we have to like really think about the day they walk or the moment they walk out the door in the morning to when they get back home. Is every adult involved in that training and implementation kind of monitoring process?
That's a wonderful point, because, at any point in that child's day, like from the time they cross the threshold at school to the time, they get on the bus to go home and are on that bus, like those transition points are sometimes critical, right? And also the people around them could make that worse or better, depending on the communication that is happening between all the staff and everything like that.
Mm-hmm.
Yeah. So I guess kind of stepping to the side for just a minute, like when we're in school receiving typical school services, how have you, or what has your experience been like here in Colorado for families who need to have an outside ABA service organization come in? Like I'm aware that it varies depending on what the district is doing and whatnot. But, overall, kind of talking about that.
Yeah, so we at NSC, so we've done a lot of care coordination with schools and external teams of providers. So have really gotten to work with some different ones, and then based on past experience as well. To your point, yes, I think district to district varies greatly. But I think as well, like what that support looks like can be really individualized and should be really individualized. So if it's a learner who academically and cognitively we're on grade level, but it's more that social piece and it's that group navigation of that support. I've seen those services or helped support ABA folks going in schools that have been supporting more of that peer interaction or the regulation related to peers. That's been something that we've looked at or have done. Or for some folks, it may be, hey, there are some prereq skills. So they might be providing direct services. And I think too, based on my previous experience, it can also look like coaching and teaching teachers and paraprofessionals, and then implementing those supports and services, whether it's classified or a group of students or individual students. Because I think, to my point earlier of thinking kind of a step or two ahead, we want to make sure that we're in the least restrictive environment for all learners, and that we're generalizing that to different adults. So it's not just, hey, I can do this in one setting and this with this one adult, but am able to accomplish this successfully and kind of know how to navigate that across multiple settings, multiple adults.
Yeah, absolutely. Absolutely. The individualized piece is so important. I think that sometimes where it gets hard, not only as a behavior analyst, but as a parent and a special educator, because you have to work within the confines of the setting that you're working in, right?
Yes, and I think that my experience of somebody who kind of has behavior and school background as a
Mm-hmm.
teacher is pretty rare. So I think it's a lot of adult communication and collaboration needed as far as, hey, you're the academic content expert, you're the behavior content expert, and then obviously the parents and the family are the child content expert, as it were. So how can we work together to make this a feasible situation?
Absolutely. Is there any part of the work that you're doing now, before we get into like, your top recommendations for resources for families, like, is there anything you want to talk about, like what you guys are doing up at Children's, like any resources, any programs that would be really helpful or beneficial to families?
Yeah, absolutely. I think one of them is there's been an additional um, track that's being piloted right now at MSC that really is focusing on that population of autistic patients who have a high level of anxiety or depression, just because that comorbidity is pretty common, but services outside of like traditional ABA and can be a struggle sometimes for families to find. So that's more of a group setting. Materials from Regulating Together are being used. So that's been really exciting. I think the continuum of services, both on NSC, Dr. Romani's new clinic, I think the plan to really expand that continuum of support is really exciting to me. So it isn't, to your point, it can really be individualized for learners and their families. It doesn't have to be kind of trying to pigeonhole into something that isn't quite right.
Yeah, absolutely. It's been interesting being a provider and a parent now with a child with on the spectrum. She prefers, autistic person, autistic individual. She's very neurospicy. She's lovely. And so it's been very interesting because she struggles with the comorbidities that you mentioned, and depression, and anxiety. And she finding the right provider has been very difficult. And we've only been on this journey with her for the last couple of years. We've been her parents for a long time, right? But it's almost like new information that you go and you're like, oh, okay, we have a new lens for this now. But truly, like trying to find providers who have like those dual specialties. I can't say enough about that. That's fantastic that those programs are opening. I'm sure you'll be hearing from me. But aside from that, like that has been a huge gap that I have noticed in our field in ABAs, that we are few and far between as BCBAs are concerned. We're even more few and far between when you start trying to understand the most common comorbidities that we do see, and anxiety, depression is huge. And so I'm going to say thank you now, and definitely make sure that we have good links for our families to access that, because I know I'm not the only one.
Yeah, absolutely. I'll add that to my list to what to share for sure.
Good. All right. So as we come to a close, tell me a little bit about like maybe your top 3 to 5 resources or skills or questions or anything that you think that parents should be doing or using for their kiddos to help them.
Yeah. So I think one is, as you're setting goals as a family, as a team for a year, to also be thinking 5 or 7 years down the road. It kind of sounds counterintuitive, but wait lists are really long. I really recommend having those conversations. Don't wait until they're 14 and a transition plan comes up, because it's legally mandated at that age, but really being purposeful and thinking about that. How old do we want them to be? Or how old do they want to be when they graduate? Is it 18? Is it 22? So I think that's something I think about. With regard to resources, the rights law book is kind of my best friend. So that's something that I have marked up and that I will refer to pretty frequently, just because kind of those Fed regs can travel with me across the various places I've been. And then other resource that I kind of from more a behavioral lens, Behavior Speak was a book that I got when I was doing my ABA courses, and it really is kind of a glossary to translate some of the jargon from the ABA field. To your point, SPED, special education has a lot of jargon, but that book has been, so there's a few others I'll share, but those are kind of my top three right now.
I love that. Do you guys use, or have you used ABA Visualized as well?
Mm-hmm.
Yeah, I love that one too. Yeah. Well, Nori, I really appreciate your time. Is there anything else you'd like to share before we wrap up today?
Yeah, I just want to thank people. I know that, to your point, it's a lot as a family navigating all the things, being a parent, being a parent with some extra strength, but also some extra challenges. So yeah, I just want to say thank you. I think reach out when you need support as well.
I appreciate that. And, we thank you for all the work you and Dr. Romani and y'all's team are doing. Well, I will follow up with you via email and we will chat more.
Sounds great. Thank you.
Have a good day.
Thanks, you too.